Hello everyone, this is Vicky from NIPER. In this video, we will discuss about different types of diseases and the diagnostic tests. A very important table for GPAT and NIPER. Questions will ask frequently from this table. The first one is your diphtheria, which is caused by Corynebacterium diphtheriae, and the diagnostic test is Schick test or LX test. It's better to know the causative organism for every disease. So diphtheria is caused by Corynebacterium diphtheriae and the diagnostic test is Schick test or Ellis test. And the syphilis is caused by Trypanosoma palladium and the diagnostic tests are the VDRL test, Kahn test and Weisman test. This Weisman test is very important. It's a diagnostic test for syphilis. The next is tuberculosis, which is caused by Mycobacterium tuberculosis. A very famous test that is Montauk's test and tuberculin test or Amades test. So for tuberculosis, the diagnostic test is Montauk's test. This is a primary test. The next is your typhoid, which is caused by Salmonella typhi. A very commonly used diagnostic that is Weidel test or tube agglutination test. The next is Vibrio cholerae. It's a vibrio-shaped bacteria. It's a cause the disease is cholerae. The diagnostic test is hanging drop test. The next is smallpox. It's a virus caused by variola virus. And the diagnostic test is your Octernoli. Next is your H. pylori, that is Helicobacterium pylori, which is a gram-negative bacteria. The diagnostic test is your urea bath test, a very important test for H. pylori, important bit for NIPER. The next is your leprosy, also known as Hansen's disease, caused by Mycobacterium leprae. And the diagnostic test is Leproman test. The next is typhus fever, which is very different from typhoid. That specific test is Veliflex test. And the next very important disease is brucellosis. The diagnostic test is very famous, that is Coombs test, also called opsonization test or brucellization test or antiglobulins test. In this test, antiglobulins are detected. That's why it's also called as antiglobulins. The next is scarlet fever. The diagnostic test is Dick test or Schludwig-Chattern test. Next is pneumonia, which is caused by Streptococcus pneumonia bacteria. And the specific diagnostic test is hemogglutinating test. The next is very common, that is AIDS. The specific test is your ELISA, Western blot test, Karpus test or PCR. And to detect the HCG in women's serum, a specific test known as radioimmunoassay, which is a diagnostic test to detect the HCG in women's serum. The next is rheumatoid arthritis. The specific test is rose water test, very important. And the last one is hemophilus, which can be detected by using Ducret test. So these are the specific tests for disease and their diagnostic tests, very important. We will look into a few past year questions. This is a question asked from GPAT 2023. The question is, the Schick test is used to determine the susceptibility to a very easy straight question, that is your diphtheria. Schick test is for diphtheria. And another question from GPAT 2020, that is Schick test toxin is sterile filtrate from a culture of. So simply it's an indirect question, that is Schick test toxin is sterile filtrate from a culture of, that is Corynebacterium diphtheriae. So very easy. You can get easily +4 marks. So very important table for GPAT and NIPER also. Thank you. Subscribe to this channel.